So welcome to our Santa Cruz County Health Workforce Council quarterly meeting. This is the meeting we convene quarterly to give you updates on our Health Workforce Council and bring in guest speakers on all areas of health workforce. And I'm excited to have you all join us today. We can go ahead to the next slide, please.
Hi, everyone, and welcome. For those that don't know me, my name is Maria Estela Jerezano, and I'm a program coordinator at HIP. So to get us started, please introduce yourself via the Zoom chat and share your interests or projects in health workforce development. Just go ahead and please share your name, title, and organization to get us started.
Thanks, Maria. Yeah, we'll put that prompt in the chat for anyone joining us late. So we will go ahead to the next slide and cover our agenda. For those of you who maybe don't know who I am, although hopefully most of you do by now, my name is Haley Mears and I'm the Workforce Development Program Manager at the Health Improvement Partnership of Santa Cruz County. And we convene, as I mentioned earlier, these quarterly Health Workforce Council meetings. So on the agenda today, we are asking everyone to please introduce yourself via the Zoom chat, share any projects around healthcare workforce that you might be partnering in or work groups you're participating in with us on a monthly basis. And then we're going to have a presentation from Cabrillo College's Community Health Worker Program. Our own consultant with HIP is going to do a presentation around the DHCS Technical Assistant Marketplace. HIP is a workforce vendor, so we'll be getting more information about that later in the meeting. And then we'll provide Health Workforce Council work group and council updates at the end of our meeting to close. So with that, I think I'm ready to introduce our presenter. We have Adrienne Saxton, who is health faculty at Cabrillo College, and she's going to share information about the Community Health Worker Program at Cabrillo College. So welcome, Adrienne.
Hi, thank you, Haley and Maria, and I'm happy to be here. Adrienne Saxton. I teach in the Health Sciences Department at Cabrillo College. I'm also at CSU Monterey Bay in the Collaborative Health and Human Services major and coordinate the field program there. So happy to be here and share a little bit about our Cabrillo College's Community Health Worker Certificates. This program was originally started when the Affordable Care Act was going to be implemented. And at that time, back in 2010, we created a curriculum to support the navigator piece of finding a health insurance provider for our community. And these navigators were going to be trained through this community health worker certificate. But at the same time, in 2011, when it was ready to go, it had been improved through our curriculum committee, the enrollment numbers were low. And so, you really can't start a new program, offer new classes when there's not enough students in general for the regular coursework. So it sat. And we got lucky in 2018, the Slingshot funds identified community health worker as a need, as a healthcare workforce need area. And so I was approached by that group about our community health worker certificate. And so we with that support and funding source, we were able to revitalize it. We looked at, we really went back to City College of San Francisco, who's like the well-known CHW certification program in California. They even wrote the book on it. And we worked with them to kind of revitalize it and get it ready to go. And so I'll talk a little bit more about what we were able to starting spring 2019. Next slide. So just for those of you who might not know, according to the American Public Health Association, a community health worker is basically that trusted member in a community that serves as the liaison between health and social services and that community to improve cultural competence and reduce health disparities while improving healthcare outcomes. So the return on investment and all of these things are well researched and well known as the important role a community health worker has in healthcare and social services. So the titles are a little bit, you know, the umbrella term is community health worker, but underneath that description are many different titles, and here are a few, but there's like 120 different titles. And then next slide, please. So these are some examples of roles and actions that CHWs might take in health and social service settings. And, you know, care coordination, of course, this culturally relevant health education, counseling, community outreach, advocacy. They can do this through the kind of skills we support them in developing, through understanding physical, social, and behavioral health conditions, really getting some, you know, knowledge about these components in our health, how to provide referrals, how to collaborate and support connections with health and social services. We support them with coaching, motivational interviewing, behavioral health coaching, and goal development in the coursework. And of course, speaking truth to power through self-advocacy, policy development, and systems change that will address the social determinants of health. Next slide. So if any of your work areas or, you know, are interested in this kind of profession or know that this is needed, we are a great place to start in developing, supporting people in developing those skills, because we do know the return on investment is valid. So one of the greatest things that has happened in recent years, starting in July of 2022, is through the CalAIM initiative. The California Department expanded the Medi-Cal benefits to include community health worker services. So there's about 4 codes now. And what's wonderful about this expansion is that it also now Medi-Cal services can be provided through community-based organizations, because so much of the social determinants of health are integrated in those spaces. Now more organizations can access Medi-Cal funding. And so if you know, the Alliance is of course our managed care plan in this region, and they have been doing some wonderful work about supporting our community-based organizations in adding Medi-Cal, becoming a Medi-Cal provider. So with that, these are the types of services that are this description here of the services that are provided that support Medi-Cal reimbursement are the things listed here, and of course more details in the actual plan. Another important thing to note is that Healthcare Administration information program through the state will be rolling out a state certification for CHWs coming really soon. And that, you know, we're right there with them on this process, and we're very confident that Cabrillo College will be one of the training programs that's approved. Next slide. So, oh dear, I'm disappointed in my photo. The 11 core competencies were that are part of the state certification process for Medi-Cal reimbursement for CHW work is based on these 11 core competencies. But just so you all know, Cabrillo College started with these. This core consensus project from 2016 did a national survey to identify the core competencies for CHWs, and HCI and the California state has acknowledged this as the core knowledge skills that CHWs need to have. And just so you know, our program was definitely like built on these 11 core competencies. Next slide. So our curriculum, by the way, this link at the title, this is a link to our incredible website that has lots of different information for students, for employers, and just in general about our program. And it'll also give you details about this actual curriculum. So the 16, oh dear, I'm sorry about, wow, it's so weird how, well, it looks like in the, anyway, so it's 16 units. You might not be able to see the 16, but it's a 16 unit California Community College acknowledged certification that incorporates these, there's a class missing, geez, an elective course that for 3 units that you can't see because of the photo. But basically that there's a personal health course, these 2 intro to community health work, and then community health worker skills courses, a requirement for internship of either 120 hours if you are new to the field, or 170 hours if you are already a CHW. And then the extra 3 units next to that is an elective course, and those elective to choose from include like case management to stress management. The AstraCs are about a program we started in 2021. Thank you, Haley. In 2021, we were one of the first programs to get a non-credit certificate started that basically is a free, someone can take these 2 courses for free or non-credit, meaning pass, no pass. And it's the same, like they'll be sitting in the class, the same exact class as the people who are taking it for credit. So this is a really wonderful opportunity for people that are looking to get certified, but maybe don't need the work experience, internship, the personal health course, which is kind of really anyway, there's a lot in that course that we think is really valuable, but you know, they could get away with just those 11 core competencies at the very basics, and get that certified. Another wonderful thing that we did when we first started back in 2019 is really to support our English language learners is innovative model and an evidence-based model out of Washington called IBEST. IBEST stands for Integrated Basic Education Skills Training. And this is a popular education or Paulo Freirean model of, oh yeah, you fixed it. Oh, darn it. Anyway, model of teaching where we have an English as a second language teacher in the classroom with the content instructor. And so this is a really beautiful thing to watch, and really does improve outcomes and language acquisition for our students. They definitely talk about the value of having the second language teacher in the classroom. Really, for any adult learner, all the students in the classroom, whether they're English only students or Japanese or whatever types of languages they might be coming from, having the second instructor in the classroom has made a huge difference for you know, folks who are coming back to school, because our second language teachers just, you know, like, you know, how to read a text, how to take notes, you know, lots of great feedback around writing and presentation skills. So that's a lot in one little slide. Next slide. So to be clear, there's the free opportunity through non-credit, or if you are going to complete the 16 unit requirement, you might spread it out into 2 semesters. That is 8 units a semester, and that would cost about $888. If you did not get financial aid, right? And most of our students end up only paying that $76 mandatory student fee cost as a way to get through the class. So we find that two things happen. First of all, that most students end up getting this through financial aid. And by the way, at California, at Cabrillo College, just for folks that don't know, undocumented students can also access financial aid through something called CADA, and they're welcome to come to our program and get the sort of certificates as well. And so financial aid is really available, and we find that most of our students get that. We also find that many of our students who come in through the non-credit path end up moving into the for-credit path because they've really enjoyed their experience in the CHW courses, and so they want to expand their learning. Next slide. So another wonderful and exciting thing we are embracing is apprenticeships. So I don't know if you all know, but Gavin Newsom wanted put in a lot of terrific funding to support 500,000 apprenticeships in California. And so the community colleges have offered these grant opportunities. We've jumped on board and have joined Berkeley City in CHW Apprenticeship Consortium. And what's happening there is they are, we together are moving in some apprenticeship standards, those 11 core competencies, to the Department of Labor, and then California's Department of Apprenticeship Standards to get this approved as an apprenticeship program. And then we are the local education agency. And so we are in the middle of a planning grant, and there's going to be an informational gathering. There are going to be two different gatherings in January. And if you're interested in learning more about the value of having apprenticeships, CHW apprentices, then please let me know, or Haley know. I'll put my email in the chat, and we'll get you the invitation to come to that informational gathering about apprenticeships, because our goal is to have apprenticeships for all CHW students. And just to be clear, this can be incumbent workers, so current employees of different organizations can be apprentices too. And with apprenticeship, by the way, the training is free. So once again, those courses would be paid for. And so we're in the middle of the planning grant, but we're also right now applying for the implementation grant that we would begin in fall 24 and roll through 27 and getting those apprentices up and running. Next slide. So yeah, our goal is to really be responsive to our region's workforce capacity needs, and we know that this is a need in our community. We know the difference these community health workers are making. It became evident during even during the most recent Pajaro Valley floods. And then, of course, during COVID, that trusted member of a community was really, really valuable and important to making sure that all people in our county and in our region received the information, access, and for example, vaccinations they needed, resources they need to stay healthy. So we want to be collaborative and encourage open communication and exchange of ideas through certainly our Health Workforce Council. That's one place where we really get to hear from our employers and make connections to exchange ideas. And we look forward to anyone who's interested in participating with the Health Workforce Council. is great. And by the way, the Health Workforce Council is also going to be a really, well, each time we meet, we'll be talking about these apprenticeships, and that'll be a space for continuing to exchange ideas about the apprenticeships. Next slide. So some ways that you can support our program as well is to promote this certificate program to your current employees or the community. And we have slides that, flyers that are available. The flyers are going to be about the non-credit certificate as well as the for-credit. We have them in English and Spanish. And then we also have information about the Cabrillo College registration fairs coming up. We do know and recognize that adult learners accessing Cabrillo College and enrollment and registration and financial aid can be a bit overwhelming. And these registration fairs are spaces where all those support services are available, including our program. Like, we'll be there tabling at the event, but really getting students into the class is a process. You have to apply to California community colleges, then you get your registration ID for Cabrillo College, and then you have to fill out financial aid or CADA. And so there's lots of steps, and the registration fair is one way to get that done in one swift swoop. And I'll have flyers for that as well. Another thing that employers might do is develop scholarships and fellowships or other professional development incentives. One thing you'll find on our website is a template for a job description that you might create for your population and community needs. Another thing is maybe to add that the CHW certificate from Cabrillo College is a preferred qualification that you would work with us to develop. If apprenticeships sound too scary, we can change your mind on that, I think, in January. But if you would prefer an internship, we definitely love to support students or support organizations in getting to have CHW interns within your organization. And then another thing that's really wonderful is we have performance-based exams each semester where actually employers, or even Grant, I saw that Grant from UCSC is going to be one of our examiners this year. And so what's really neat is you get to see the type of output that our program is creating through the Community Health Worker Certificate Program. And with that, we get both programmatic support as well as students get their individual evaluations from people in the field of work, and of course that results in jobs for them often. So these are some ways that you can support us, and then I'd love to hear from you. I have a few questions on the next slide, and I know that I've seen there's been like tons of chat. So also, Haley, maybe you want to help me get through the chat questions, but these are some questions I have for you that you might respond to me about, or let's start from there.
Thank you, Adrienne. No, I don't see any questions in the chat, but if anyone does have questions, feel free to unmute and go ahead and share any questions or ideas for collaboration you might have for Cabrillo College's Community Health Worker program. I love your prompts. Are we on the right track? What are your concerns, and how can we be responsive to your needs? If anyone has thoughts now and would like to share, or feel free to email Adrienne. She'll drop her email in the chat for you all. And you could also just follow up in the chat box if you think of anything while we're convening today. I'm not seeing any raised hands, so I think we will move on to our, oh, I love this photo. Adrienne, do you want to go back to that photo? Do you want to explain what that is?
Well, these are the first cohort of students. Our entire website is built on the photos of our students, and yeah, just they make me so proud. And this is at our Watsonville Center. Our Watsonville Center is a wonderful space for learning. It's very family friendly. People are multilingual. All the support services are available there. We have, you know, a librarian, we have tutoring, we have computer labs. We have, of course, all the financial aid, the registration services are there, counseling, healthcare services. So in this one small, mighty place, students have access to all the incredible community support services that exist through Cabrillo College. So yeah.
Yeah, the photos are wonderful. They're so good. They look like stock images, but they're not. They're
No.
they're the teams and the students. So it's really nice.
Yes, we had a professional photographer. It was just this wonderful thing. And so you'll see our photos all across the Cabrillo website.
Okay, well, thank you so much again. Adrienne dropped her email in the chat if you want to follow up with her. If you're interested in joining the monthly convening that Adrienne mentioned, HIP facilitates that. Feel free to email me and we'll get you added to our distribution list and send you the calendar invites. We meet the third or fourth Thursday of the month from 2 to 3, fourth Thursday of the month from 2 to 3. Virtually. So we have space and capacity to invite more people to join us. Okay, so we're gonna go to our next presenter, who I'm excited to share is joining us, Amy Mancia. She was in a consulting capacity with HIP, but just recently, I think as of yesterday, perhaps, is now joining us as an operation strategist with HIP, and she'll be working with us for the next half of the year. And so we're excited to have her share some more in-depth information about HIP's role as a workforce vendor in the CalAIM Path Technical Assistant Marketplace. It's very confusing, I find. So having someone like Amy here today to help kind of break down all the information for us is going to be really great. So Amy, I'm going to hand it over to you.
Thank you, Haley, and thank you all for having me. As Haley mentioned, my name is Amy Mancia, Operations Strategist at HIP, and I'll be providing an overview of the marketplace, outlining what is the marketplace, how organizations can access it. As mentioned, HIP is a vendor. We are approved to provide services in the workforce domain as well as another domain. And so I'll speak a little bit to our offerings as well in my presentation. I hope that the process seems a little less confusing as I go through it. It is a very simple, complicated process. And so the more we build awareness to it, I hope the more people register to get access to services because the state pays for the TA services. So next slide, please. Thank you, Maria. So the Path Technical Assistance Initiative will enable entities that are providing or intend to provide ECM community supports under CalAIM to access technical assistance from an array of qualified vendors. Through the marketplace, the state provides funding to cover technical assistance costs for project proposals and TA requests set out by providers, community-based organizations, counties, and other entities. This initiative is brand new. It just launched earlier this year, and it is intended to go up until, I believe, June of 2027. So there are a couple of years of funding for TA. Next slide. So here's just a quick snippet of the website, which you all can always feel free to go and look at. There are several resources here. Many of my slides that I'll be presenting today come from this website as they've been publicly made available to organizations. And then you can also find the application to apply for TA and eligibility on this website as well. Next slide. Okay. So there's 7 domains under the TA marketplace, which include technical assistance on building data capacity, community supports, ECM, receiving support to contract or build relationships with an MCP, promoting health equity, supporting cross-sector partnerships, and workforce. If needed, there are vendors who have been approved as meeting the cross-cutting competency, which is holding the expertise to provide TA services in rural communities. And the Health Improvement Partnership is approved for domains 3 and 7, which are engaging and empowering through Medi-Cal managed care and workforce. And for more details on every domain and some ideas of potential TA services, please feel free to refer back to the state website that was shared in the last slide. They have more of a granular breakdown as to what encompasses each domain, as well as some project ideas that people can feel free to propose projects under. Of course, it is not limited to that, but it provides more detail. Next slide. So moving us along into who is eligible to become a TA recipient, the state has set out several guidances on eligibility criteria and how to access TA, which I'll review over the next couple set of slides. In order to be an eligible organization, the state has set out several eligibility criteria that are listed here on the slide. TA recipients may include, but are not limited to, city, county, and other governmental agencies, county and community-based providers, which include or not limited to public hospitals, CBOs, correctional agencies, and other justice-involved stakeholders, and tribal designees and Indian health programs. And every organization must meet one of the criteria, which is on the right side of the slide, which are 3 options: whether you are contracted with an MCP, you are actively engaged with an MCP and are planning to contract, or if you have not contracted with an MCP and don't have any engagement, then you may still receive TA services, but you have to email DHCS and provide a particular request, and then they will confirm whether or not you are eligible to then be a recipient on the marketplace. And MCPs are not eligible to receive TA through the marketplace. That's just a disclaimer. Next slide. So here are the 3 simple steps to accessing TA. It's broken up into these 3 steps to make sure that every organization has the appropriate approvals, and DHCS and PCG are able to provide the adequate oversight of the program that is needed. So the first begins with a TA recipient eligibility application. The second is a TA project eligibility application, and those tend to get confusing because you have eligibility and eligibility. One is simply to confirm status that you can receive funding for projects, and then once you've received that status, you can then put an eligibility application for the TA project of your choice. And then the third step, this one is for vendors, which is to put together a TA project scope of work and budget for DHCS and PCG to review and approve, so that the recipient and vendor could start working with one another. Next slide. Okay, so going a little bit more into step 1, if you have not already applied to be a TA recipient, then the step applies to you. Those who are already accessing TA have undergone this process and should be familiar with the guidance. This step is a one-time process only that is submitted on the TA website. Recipients must include an attestation form with specific guidance based on where their organization identifies itself on the eligibility criteria that was shared in the previous slides. And then once the application is put through, the state then revises it and confirms whether or not an organization has been approved to be a TA recipient. And then once they receive that approval, they can move into step 2. And I think the processes have gotten a lot quicker these days. These used to take several weeks to get processed. Now, I believe there should be about a week or 2 turnaround to hear back from DHCS or PCG on whether your organization is eligible or not. Next slide. So how this slide is some guidance for organizations who meet the criteria of option 3, which is they have not engaged with an MCP and require DHCS approval. This slide simply outlines where you can contact DHCS to make that request for approval. They excuse me, ask that you send in your organization's mission, the service offerings, as well as populations and geographies, and the reason why you would like to access TA through the marketplace. They have some requirements around how to email them, the subject, etc. And then they will confirm or deny in writing. And then if you are approved, then you will be granted access to the system so that you can move into the second step. Next slide. So step 2, once organizations have been approved to be a recipient, they're then able to put through project eligibility applications for TA support services they would like to receive. As mentioned earlier, there is a wide array of TA vendors and domains which organizations can peruse around in the marketplace to see what types of services each vendor is offering, and then put through an eligibility application for every project they would like to secure funding for. I believe each application will ask you to select up to 3 vendors of your choice and rank them in preferences. Public Consulting Group, who manages the TA marketplace with DHCS, will then confirm whether or not your preferred vendor has capacity to take on your project. If they don't, then they start moving down the list. But once they have confirmed a vendor with capacity, DHCS will then communicate a project approval notice, and the vendor will work with the recipient to put together a scope of work and budget to be submitted for review. And then once all these 3 steps have been reviewed and approved by DHCS, then organizations can begin to access the TA requested. Next slide. So there are 2 modalities for accessing TA, and this is probably one area where it might get confusing, because you can access hands-on support or off-the-shelf support. The key difference here, I would say, is that off-the-shelf projects are essentially prepackaged products. They're more standardized resources. Hands-on is a bit more customizable in the sense where, and you'll see in the next slide, in the sense that it has a bit more questions. The organization puts a little bit more visioning into their eligibility application. And then off the shelf has a more prepackaged vision. Some of these offerings are very customizable to the organization, but they just simply are prepackaged at a fixed cost and have some regulations around maybe how many people can participate in the process, how many meetings are included in it, et cetera, and then hands-on is then more customizable. So next slide. Okay, so going back quickly to the eligibility process, and I sort of hinted at this, but here are the differences that each modality will require. The main difference is just that it'll ask you to provide some responses to additional questions around visioning of what the project needs are. And so there'll just be a few questions. They're not super lengthy. Many of them have very low maximums of like 350 words, 500 words, for organizations to then go put in what their needs are. And then when the project is approved and you move into the scope of work and budget pieces, the hands-on TA project budget is more customizable. They can customize the number of hours, the number of meetings, and scope it out in that way. Versus off the shelf, you purchase something for a certain cost, the state then approves it to be at that specific service at that specific cost. So next slide. Okay, so as mentioned earlier, here are the 2 domains that HIP offers services with some potential projects that we are able to provide support in. For domain 3, we are able to provide some strategic planning and implementation support around building relationships with MCP and executing ECM and community support contracts. We have been in discussion around doing some more strategic planning and helping organizations develop, revamp their new strategic plans in line with CalAIM and these different shifts. And so that is a service that we are able to provide. We're also able to provide some best practices, so adhere to program requirements. We're able to develop program satisfaction metrics, et cetera, and identify organizational gaps and areas to build capacity under this domain. For workforce, we are able to do some relationship building with UCSC and Cabrillo College to develop some ECM pipelines and build on what has already been made available in our community, and have, the state cover those funds, which is great. That we are able to provide some case management core competency training, as well as integrating competency-based training programs. At the moment, our services are solely hands-on, but we are in the process and hopefully hearing back regarding some off-the-shelf products that we have put through. And so if those are approved and you all would like to explore what off-the-shelf projects that HIP has to offer, those should be made available early next year. Next slide. So I'm quickly about to wrap up, but just a quick shameless plug on behalf of our partners before I wrap up my presentation today. As part of our TA offerings under Workforce, we have partnered with EM Consulting and Holly Hughes & Co. to put the Case Management Academy onto the TA Marketplace. At the moment, it's not listed as an off-the-shelf project, but we have worked with some organizations, including Santa Cruz Community Health, to get them approved to receive this service as a hands-on project. And so the next CMA has been scheduled for April 12th to May 24th of 2024. The trainings will be taking place Fridays from 9 to 12, and they include 8 3-hour workshops covering an array of topics, including high-touch case management, helping people with addictive disorders, motivational interviewing, trauma-informed de-escalation, lowering stigma, and so much more. And if you would like to learn more, please feel free to contact me or Holly. I'll go ahead and plug my email and Holly's email in the chat shortly. And if your organization is eligible for the marketplace and has interest in sending some care managers to this training, please feel free to reach out so that we can ensure you hear back on all the required approvals in time for the next cohort. Next slide. Okay, so here I've linked the many guidances that DHCS has made available on their website as well. They'll be linked here. When you all receive the meeting sites, you can go ahead and press to them. There is just some key guidance around the marketplace, the TA domains, some information and a walkthrough for the TA project eligibility application, as well as frequently asked questions for new TA recipients. Next slide. Okay, so that is the end of my presentation. Thank you all again for having me. If you have any questions, please feel free to ask in the chat or unmute and I will try to answer. If I do not have an answer to your question, I always recommend please do reach out to DHCS and PCG. Their email is on the slide where you all can always redirect questions.
Thank you, Amy. Hopefully that helps people better understand the TA Marketplace and HIP's role. That's really exciting about the training that's going to be offered. So as Amy mentioned, if you think your organization might be eligible, you can apply for funding and send some of your staff to the training in April. That would be amazing. Any questions for Amy? Feel free to unchat or unmute, or you can put your questions in the chat. Adrian?
Hi, there were 2 things in the slide I didn't know. They were acronyms, CITED and JI. I don't know what those are. CITED.
Yes, so JI is Justice Involved. CITED is a longer acronym that I can't remember off the top of my head, but it is essentially a CalAIM grant that is available to organizations implementing CalAIM. And so PATH is essentially a system that encompasses several of these initiatives. So they have the facilitators group, then they have the marketplace, as well as the CITED grant, and then several other opportunities.
Okay, thank you. Yeah. Appreciate that.
No worries.
Any other questions for Amy at this time? You can also, she just dropped her email in the chat, so you can also reach out to her over email. If you, I don't know, go home later tonight and then you come up with a question or you think of an amazing idea where you might be eligible to get some marketplace funding, feel free to reach out to Amy. I'm not seeing any raised hands or any questions, so I think we'll move on to our Health Workforce Council updates. So yeah, I'm excited to just share what our work groups have been up to for the last quarter. So at our previous meeting, we reported out what we had accomplished. What was that? Up through August. And so we're now kind of reporting out on what we've accomplished. We're at the beginning of December, so there are some projects we'll be working on completing this month. So our Integrated Behavioral Health Action Coalition, we utilize that group and once a month have a meeting around workforce issues in behavioral health. And I'm really excited to share that HIP, in partnership with UC Santa Cruz, with some support from Santa Cruz County Office of Education, have submitted a HCI Health Professions Pathway Grant. We submitted it within this quarter, and we will hopefully find out about awards in the beginning of January 2024. If we're awarded that funding, it will pay for summer internship stipends for approximately 15 students. So hopefully students from UCSC and Santa Cruz COE to get placements at healthcare internships. So that would hopefully be with lots of organizations on this call and organizations across Santa Cruz County. And the exciting part about this grant is it would fund this summer internships for 5 years. So that would really help us create a pipeline, a continuous pipeline of healthcare internships for students for 5 years. We also had a presentation at our last workforce meeting for IBHAC. And we were really excited to learn that Santa Cruz City Schools Career Technical Education is seeking a teacher to work with them on launching a behavioral health CTE course for high school students. And just hearing that so many students in their district have expressed interest in learning more about behavioral health careers and what those career pathways would be is just really exciting and warms our hearts. So we are going to help Santa Cruz City Schools hopefully identify someone who could teach that class. The requirement is not a teaching credential, but it is experience in the field of behavioral health. And then the school district will work with whoever is an eligible candidate to get them a CTE credential. And the understanding I have is it's a fairly easy process and the district will pay for that. So really just finding someone with expertise who is interested in teaching young adults and high school students about behavioral health careers would be what they're looking for. So once we have more information about that recruitment, we don't have a job announcement yet, but we will be getting one from Santa Cruz City Schools, and we'll be sure to share it out to our Health Workforce Council distribution list. If you have someone in mind right now or you're interested, feel free to email me and I can forward you to our contacts at Santa Cruz City Schools. So we're just super excited about this opportunity in our county for more young adults to learn about behavioral health careers. Our medical assistant work group, oh gosh, sorry, I don't know if you can hear that. It's my cats in the background. Our medical assistant work group, one of the things that HIP facilitating these monthly work groups really helps with all of the employers and partners joining us on a monthly basis is we can then turn around and help host Cabrillo College's CTE advisory committee meetings. Those are required meetings that Cabrillo College has to hold and bring in employer partners so that they are eligible to continue receiving certain types of funding for CTE. So this quarter, we hosted that for the medical assistant advisory committee meeting. And then part of the work group, it's a project that we're working on this month, and we've worked on it last month, is developing a medical assistant student survey to determine what are the barriers to employment. Why are students graduating from the program, yet not going into employment and medical assistant careers locally. So we'll be working on finalizing that survey to send out at the beginning of the new year. And then our Santa Cruz County Nursing Council, we are currently advocating for revised HCI Song-Brown loan repayment criteria. If you're on the distribution list for this Health Workforce Council group, then you probably did receive an email from our Nursing Council requesting advocacy support. It's as simple as emailing HCI and letting them know you support a revision of eligibility criteria for nurse loan repayment in Santa Cruz County. Currently, not all nurses are eligible. The email has key bullet points that explain it more in depth, but just to summarize, a lot of nurses aren't eligible, and teaching faculty aren't eligible based on the location of either where their work is located or where the training site is located, yet they're still serving our entire population. So I encourage you to review that email. If you didn't get it, you can shoot me an email, I'll forward it to you. We're hoping to really get a lot of advocacy to HCI so that maybe we will be able to get more of our nurses locally getting loan repayment, and that would help with retention and recruitment in our area. Additionally, for many of you who attended our last meeting, may be aware in August, we were able to host a nurse retreat at 1440 Multiversity, specifically to nurses across Santa Cruz County. Again, this is to address retention and rejuvenation for our current nursing workforce who are very burnt out after COVID in the last several years. So we've created a request for funding, which we're hoping to seek funders to offer this retreat again in the new year. And that retreat was provided to about 50 nurses free of charge because we were able to secure funding. So if you know of a funder or your organization maybe has some funding to put forward for this incredible opportunity, we would love to hear from you. And lastly, under our Santa Cruz Nursing Council, just for this quarter, we'll also be supporting, as I mentioned, Cabrillo colleges and CSUMB's advisory committee meetings. So again, it's really important that our partners and employers in our county attend those meetings and help provide the employer feedback and industry connections that these colleges and training programs need to continue with their program development. Andrea, do you want to speak quickly on the Monterey Bay Community Health Worker Collaborative since I have you on the call?
Sure. We were lucky to be highlighted through the Santa Cruz Sentinel in an article. We'd love for you to take a read. It's short and sweet, but two of our CHW students were highlighted in the article. And I think that I don't know, they're inspiring to me, and I think they might inspire you too. So we were really happy to be highlighted there. And they, HIP supported us in our advisory committee meeting this month this semester as well at Cabrillo College. And I think in the last Workforce Council, we talked about some of the other things that we did, which is, some of the other things we've done, like the proclamation for CHW Health Awareness Week and things like that. So we've just been really enjoying and motivated for the work. Oh, and of course, the other big part is our Workforce Council will be a big part of the apprenticeship advisory that is a requirement for apprenticeships as well.
Thank you. Yeah, and I think for me personally, one of the main focuses, and we've been doing it this quarter, is to really just spread the word about the Community Health Worker Program. And so Adrian's been presenting in multiple different groups to share out and let people know about this amazing opportunity locally for them to either send, existing staff to upskill or share out with, anybody that they know of in their networks. So thanks, Adrian, for doing all of those presentations with us. And then for our primary care and pediatrician work group, Cal, I have you on the line. Do you want to share?
Sure. Hi, everyone. Cal Gordon from Public Health. I would note that I work with both Maria Estella and Haley to lead this particular work group. We started out of the pediatric work group that has been around since COVID, where we have frontline pediatricians representing basically every medical group in the county, as well as the County Office of Education, leadership, and public health as a group. And we've added additional people. We have Grant Hartzog from UCSC, Walt Mills from the Dignity Morehouse Family Medicine Residency Program, and some family physicians, including Amy McEntee, who's Chief Medical Officer at Salud, participating on this work group. We started last in terms of work groups out of HIP. We started last January, and we've been having monthly meetings where our primary focus was really documenting the shortage, focusing on successful programs, and telling our story. As we kind of go into this coming year, we're continuing to work on those areas, but we're focusing on our pipeline development, how we can really augment that. We had some great presentations today from the medical director out of Natividad and Salinas, as well as the UCSF leads for the nurse practitioner roles of pediatric and family medicine out of UCSF, and talking about how that pipeline can be developed. There's an emphasis that if we really want to create a pipeline, we need to create more clinical venues for these people to actually practice some of their clerkships, their internships in our setting. And there's a high percentage of individuals who when they work in the community clinical environment, they actually, once they graduate, they stay to continue to work for those organizations. We're also looking at how we improve our recruitment and retention, how we tell our story to our community members, because I don't think people quite understand the shortage we face and the challenge of recruiting primary care workforce into our county that we're competing against counties around us. That housing is very expensive, and there really has to be oftentimes a local connection to get people to come our way. And then lastly, we're working with our County Office of Education, where they're working for all medical areas to develop both an interest and motivation to go into medical fields, and we're working on an online system to support that, but also to include both the pediatric and primary care physician and advanced practitioners, how people can actually go there. In addition, we're working with our schools to make sure that people get the education they need to be successful in these career pursuits. So that's it for our work group.
Thank you. So yeah, that's just kind of what our work groups have been doing in this last quarter in a nutshell. If you're interested in joining us on any of these projects or in these monthly work groups, they all meet virtually. And feel free, I dropped my email in the chat again, feel free to reach out to me if you have a colleague or someone who you think should be participating. We're happy to have more people join our efforts. I'm gonna go to the next slide. So some of the areas we're still working on getting kind of up and running is we'd really like to focus on providing some type of surgical technician pipeline program. We currently don't have anything in Santa Cruz County. And so we've been in discussion over the last year with Futuro Health, which is a nonprofit organization really throughout California right now, but they have expressed an interest in partnering with us on developing a surgical technician pipeline. They're currently working on launching a new surgical technician training program. And the last update I heard was it's supposed to launch in the beginning of 2024. So stay tuned, and we hope to have more information to share in the new year. And some of the other, go ahead to the next slide. Some of the other areas that we've been helping support, but don't necessarily have a work group convening around, is home health aides, and the Watsonville Adult Santa Cruz Adult Education School was able to just recently put together and launch a certified home health aide course. It's going to be starting in January. And currently they actually need more students to be able to hold the class. So please share widely. We'll share the flyer in the chat, and we'll send it out with our email follow-up. If you know anybody who would be a good candidate to join the program, you can email Connie Williams. Her email is here with more information. And we would love to help support and see this program get launched and be full enrollment and be successful. So I don't think we have anyone from hospice on the line, but that will also we'll make sure to send this to them and see if they maybe have some ideas of students who can enroll. Next slide, please. So one of the other areas that we're helping support and want to help promote is dental assisting. And so I received this update from Santa Cruz County Office of Education. They were actually awarded the California Apprenticeship Initiative planning grant, same grant that Adrian was mentioning that Cabrillo College was awarded for community health workers. Santa Cruz COE was awarded to start to transform their dental assisting program into a registered apprenticeship. They are partnering with Dientes Community Dental as their primary partner to get this effort going countywide. And so they're basically in the process of submitting. You have to submit all these standards in order to get your apprenticeship up and running. So they're working on submitting those apprenticeship standards nationally with the National Center for Healthcare Apprenticeships, and then with California's Division of Apprenticeship Standards. So they're applying for an implementation grant starting in they'll submit that in January 2024. And then if they're awarded those funds, they'll be able to move into that next phase of implementation, and they'll need more employer partners to engage with them to start this dental assisting apprenticeship program. So we're excited to learn more as things progress. And again, we hope to share out more about this in the new year and possibly have someone from Dientes and Santa Cruz COE join us at our next quarterly meeting to do more of a formal presentation. We just wanted to let people know that's also in the works at this time. Next slide. I'm going to share a couple recaps of things that we did in this last quarter. So we had the opportunity to present at HIP's council meeting in September and really share kind of an in-depth about what we're doing in the Health Workforce Council and why the work is important and getting leadership buy-in. So Anna Sutton and Jasmine Najera spoke to healthcare leaders. Actually, Jasmine, I have you on the line and there's a picture of you here. Do you want to unmute and just share anything about attending that meeting and presenting?
Hey, y'all. Yeah, it was an amazing opportunity to share with the council. I'm definitely a huge advocate of behavioral health services and really growing our workforce development pipeline. At PVPSA, we have a tradition of overseeing or providing master's level clinical supervision to up and coming clinicians. And so I'm so grateful to have kind of stepped into this arena in my new role, because there's an absolute lack of folks coming into this workforce currently. And we're feeling that at PVPSA, where traditionally we have up to like 20 interns a year, and we struggled to get 10 interns this year. So, and I think that just the more that, especially this meeting for me is such a great opportunity to be able to network and connect with folks that we may not always be in the same room together, but we definitely have touch points, and it provides that amazing networking opportunity as well. Thanks, Haley.
Yeah, thank you for joining us and presenting. It was just also really nice to connect with people in person. So if you go to the next slide, you can just see that There was a lot of engaging conversation among people, and it was well attended. It was well engaged group. And the last photo in the bottom corner is our HIP team just celebrating after that meeting, as we also don't get to see each other in person, even though we all collaborate virtually on a daily basis. So it was a really nice opportunity for everybody to connect in person and network. And it was great having presenters there. So thanks again, Jasmine, for attending that. We also, if you go to the next slide, I'm excited to share. So, you know, for many of you know, we've been doing the Health Workforce Council for about a year. Like, we just launched it. But what's been really exciting is in the last couple months in September and October, I was able to share at different conferences the work that we've done, our implementation strategy, how we set up the Health Workforce Council, and what each work group has been doing and projects that each work group has been focused on, and what our accomplishments are to date. And so I was able to present at with the California Workforce Association. That bottom picture on the left is with Nathan Koo, who's with the Santa Cruz County Workforce Development Board. And then Adrian and I, who's on this call as well, we were able to present at the California Community College Association for Occupational Education. And it's really exciting for us to just share what we're doing, and it's a model that other regions can replicate and utilize our best practices and our implementation strategies. And so both of those presentations were well received, well attended, and I guess the message here is to let people know we're sharing out the work we're doing in Santa Cruz County, and that includes all of you partnering with us and engaging with us, and people in other regions are really excited to hear about the work we're doing. So that's a lot of energy there for us to continue this work. Next slide. The other in-person event that we had that I'm also really excited to share about was we were able to partner with Cabrillo College and Your Future is Our Business and host a health career expo that just happened in the beginning of November. I think Yvette, are you on the call still? She might have dropped off. Well, we had the executive director of Your Future is Our Business here earlier. I was gonna put her on the spot and have her share about the event, since they did a major lift for organizing and coordinating this along with Cabrillo College. But there's just some pictures here of the event. So we had about 135 students, high school students across Santa Cruz County attend. We had about 25 different employers and training partners tabling. This is the first time ever opportunity we've had to host something like this, and we really hope to continue to offer this annually with Cabrillo College and Your Future's Our Business. There's a little link to the event recap we'll drop in the chat for you. And one of the features of the event, you can go to the next slide, is students were actually able to tour Cabrillo's allied health facilities. So about 78 students got the opportunity to go through the facilities and see the labs and the classrooms for medical assisting, nursing, and radiology. So there's some pictures here of the students getting to engage. And this is something we had heard in our listening tour we conducted at the beginning of 2022 from our healthcare partners, that they really wanted opportunities to engage with adults early on, young adults early on, and share opportunities and information about healthcare pathways. So from just hearing that in our listening tour, we've now come to full circle, able to like host this event. So it's just really exciting for us to see things that we heard about come to actualization in Santa Cruz County. Okay, so we're going to switch gears and kind of move forward into what's next. I'm going to let Maria share about that.
Thank you, Haley. So this is how our next steps at the beginning of next year are looking like as we conclude December. I did want to let everyone know that all of the work group and health workforce council calendar invites for January through June have been sent, with the exception of the primary care / pediatrician workforce work group. We will be sending those invites by the end of this week. So in January, we're focusing on our progress report and then preparing for the 2024 listening tour in February. Lastly, in March, we've been selected to present the Health Workforce Council's accomplishments at the CPCA Workforce Symposium, and we're really excited about that. We've been talking about just, going out there and presenting our work. Our next Health Workforce Council quarterly meeting will be on Wednesday, March 20, 2024 from 11 to 12:30 p.m. If you did not receive the calendar invite, or if you would like to invite someone else to join, please feel free to email me, and that way I can send them over to you. I also want to plug that, just a reminder that all of our Health Workforce Council quarterly meeting recordings are available on our webpage, and I'll share our webpage so that way it's accessible to you all.
So with that, we will close with just any questions anybody has. We're really excited about what we're going to be moving into in the new year. Again, if you're interested in participating in a work group, or your organization would like to be involved in our listening tour that we'll be preparing for, please do email us. And we are also excited to hopefully share out in our March quarterly meeting, which Maria just mentioned the date. Well, the CPCA Workforce Symposium will be prior to that. So we'll get an opportunity to also share about that conference and our presentations. So we'll just pause for a moment if there's any questions. Anyone wants to unmute or ask questions in the chat? I'm not seeing anything, so quiet group. I guess we're just doing our job really well and everything's crystal clear. So yeah, so next slide, we just want to say happy holidays and thank you all for your partnership and collaboration, and your engagement is what helps make our work so incredible and impactful in the region, and it's exciting to share it statewide. So please do continue to partner with us and collaborate with us, and we just want to say thank you and happy holidays.
Happy holidays, everyone.
Yay! Yeah, we can end the recording. Thank you all.